Doctors, what was the dumbest patient you've ever had and why? And for all of us future patients, take notice story 9. Do not be that lady. Had a patient who was coming back post-lap band for a checkup. What we usually do is revise the patient's weight, etc., and tighten the band or loosen it as needed. Now, the thing to remember is that getting a lap band isn't as easy as just throwing down some money. For 6 months, the patient must meet with a psychiatrist and a dietitian to understand what they're getting into and if they can adjust their lifestyles and actually commit. A weight loss target, for example, lose 10 pounds, is usually set for the end of the 6 months to ensure the patient is serious. So after all of this rigorous evaluation, a patient is deemed fit for an operation. Enter my patient, Sylvia. I checked her chart. BMI before surgery was 40. She was morbidly obese and now had come in for her first follow-up to ascertain if she'd lost any weight. Well, I put her on the scale, calculate, and what do I see? Her BMI was now 45. Perplexed, I asked her to explain her diet to me. Sylvia, well, I've been doing a liquid diet just like y'all said. Me, very good. Can you maybe tell me what you're having? Sylvia, I make smoothies and have them whenever I feel hungry. Me, so what do you put in your smoothies? Sylvia, cake and ice cream. Me, nothing but silence. Yep, she was serious. Somehow, it didn't occur to her that this wouldn't be healthy. We reversed her band. They reversed the band? I'm surprised they didn't just install a tiny ice cream parlor inside of her, savor the effort. Story 2. An older lady was brought into the ED, barely conscious, by her husband. In a very thick Italian accent, she told the doctor she was going to pass away. She had complained of feeling tingly and having a dry mouth prior to passing out. The doctor sat the husband down and they did a history. No serious medical problems, and she was very fit. In fact, she spent the morning cleaning her son's bar, as she often did on a Sunday morning. Considering her age, they took these symptoms very seriously and began running tests to find the source of her ailments. The son came in to visit his mother, and on the way, he bypassed his bar. He noticed that his mother had helped herself to some of the treats prepared the night before. The son, the apple of his parents' eye, had to then explain to his father and the doctor that the treats she had enjoyed were space cakes, and apparently she really enjoyed them as she ate quite a few. They then had to sit down and tell this elderly lady that she was not going to pass away and that she was, in fact, spiked. Fortunately, she was still spiked enough to see the humor in it. Story 3. Had a little boy with very little intestine left after many surgeries had removed the non-functioning bowel. So he could not eat by mouth. He was fed a high-calorie, highly nutritious formula through a tube in his stomach, which then went through for absorption, ending into his ileostomy bag. As you can imagine, it was very hard for his body to retain calories or nutrients, so his growth and development were very behind. One day, he's brought into the ED by mom because he is dumping too much liquid stool into his bag. He was brought in on a gurney, holding a bag of Cheetos and drinking Pepsi in a baby bottle. Story 4. I don't like speaking ill of my patients, mainly because I think we all neglect our health to a certain extent volitionally, and that can be viewed as quote-unquote dumb. But the winner is, let's call him Aristotle. Aristotle is a 35-year-old highly functional corporate lawyer. Aristotle has G6PD deficiency, and in his case, he develops mild hemolysis when exposed to certain foods, including fava beans. Every year, for his birthday, Aristotle goes to the fancy Greek restaurant and gets gigandis blackie, his favorite dish. Every year, he develops mild hemolysis with mild jaundice and dark whiz. And every year, he comes to see me, his gastroenterologist, urgently and without an appointment on the day after his birthday. Bull in China, shopping my clinic, yelling at the secretary and other patients if he could be seen first. Every year, he repeats his highly anxious concerns that his liver is screwed up because he's mildly jaundiced and has dark whiz. And every year, I tell him it's from the gigandis blackie. Every year, he resolves never to eat it again and is fine for the rest of the year on his G6PD diet. And then, every year, you got it, on his birthday, he forgets and the cycle continues. Story 5. Not a doctor, but I work in a doctor's office as a MOA, specifically pediatrics. A secretary buzzes back to me that there's a call on line 2 that needs medical advice. I pick it up and one of our patients' mothers is on the phone having a panic attack. She is hyperventilating into the phone. I asked her if she was all right, thinking maybe she needed an ambulance, and through her breaths and now tears, she started telling me that she thinks her 4-year-old son has a skull fracture. I asked if he fell. No. I ask if he's conscious. Yes. I ask if he's breathing. Yes. I ask if he is hurt from his ears, eyes, nose, mouth, scalp. No. I ask if there is any visible wound. No. I ask why she thinks he fractured his skull. Because underneath his eyes is red and puffy, and Google says that's a skull fracture. I tell her to go to the ER for a proper assessment. We don't do MRIs, X-rays, or CT scans. She doesn't want to. She says she was supposed to take her kids to the beach. Mind you, she is still crying and breathing heavily at this point. I told her to come right over then, but warned her we would probably have to send her to the ER. She shows up 15 minutes later, cradling the child and crying. The little boy was crying too and screaming, "I don't want to pass away, Mommy." She kept hushing him and saying, "Mommy loves her strong boy no matter what," which only made him cry harder. I pull her back into the room and she just dissolves, and she tells me how she looked at him in horror this morning and saw the guaranteed signs of a skull fracture. She swears he must have hit his head yesterday at swim practice. The little boy is crying hard, but I can see the noticeable swelling and pinkness under the eyes that she was referring to. I went to get the doctor and I told her what I thought. She went in, came out about 10 minutes later, shaking her head. She had the same diagnosis. You know when you wipe your eyes after swimming, you usually wipe under your eye too? The kid must have wiped off his sunscreen around his eyes the day before. All the pinkness and puffiness was from a mild sunburn under his eyes. Story 6. Dentist here. In school, I had a 70-year-old patient who was still in the dating game and looked like that old lady who just passed away who played the genie. I was thinking of Joan Rivers. She's got a ton of acid erosion on her teeth, tells me she drinks on 3.0 water, didn't know what was in it. We looked it up on Google. That'd be a pH of 3, all her water. Plus, she likes to put lemons in her water. I tell her this is also acidic. She tells me I'm wrong because her friend who took a few nutrition classes said that as soon as the lemon juice gets into the body, it turns basic. I told her I had a biochemistry degree, and that was wrong. Also, her pressure is super high every visit. She tells me that she stopped taking her BP meds because she thought they were unhealthy. I tell her that her method isn't working at all. A few weeks later, she strokes out and never gets out of a wheelchair again. I'm friends with her on Facebook now. It's just sad. Story 7. Patient came in with a rash around her mouth. She was going on about how she had it 14 years ago and the dermatologist prescribed a certain antibiotic to cure it and then diagnosed her with perioral dermatitis. She's showing us pictures on Google. Okay. Doctor diagnoses her with impetigo and prescribes her an antibiotic ointment. She leaves and fills the prescription and comes back flipping her crap. She Googled impetigo and with the help of WebMD, came to the conclusion that it was a children's disorder on the arms and legs that can only be contracted from children and she wasn't around children. Insists that what she believes she has, perioral dermatitis, is a quote-unquote woman's disorder and she doesn't have this quote-unquote children's disease. Says that the antibiotic he prescribed isn't on the list of treatments. Thanks, WebMD. It's on the top of the list actually of, actual medical books, but whatever. Whole time, she's showing us these pics off of Google of perioral dermatitis saying it's a woman's disorder. Half the pictures were of men. Now, one thing you should know, perioral dermatitis means rash around the mouth. That's it. It doesn't mean crap. It's not a type of rash. It's not only cured by a specific antibiotic, it's just a rash that happens to be around the mouth. She was furious, shaken with rage, and about to start throwing crap because the doctor wouldn't prescribe her this certain antibiotic. Doctor told us to call the cops if she came back. People are crazy. Story 8. I'm a student and my GP supervisor was involved in a scheme to reduce A&E waiting times by having a GP in A&E to take patients that weren't actually in an accident or an emergency. As none of the patients were actually dangerously ill, I was basically doing the consultations with the doctor supervising, double-checking and signing prescriptions, etc. A guy in his late 20s walks in, looking very healthy, and sits down. I was stung by a bee this morning. Okay. Where? Oh, my cheek. There's no swelling or anything visible. How long ago was this? Well, it took me about half an hour to get here, and then I've been waiting another 3.5 hours. I wonder why. Did it stop you from swallowing or breathing? No. Are you allergic? No. What would you like us to do? Just, check I'm okay. At this point, I turn around to my supervisor, attempting to say, what the heck do I do here? He says, you're okay, go home. It was the most surreal consultation I've ever had. Story 9. I work as a receptionist and office assistant at a large clinic, so I'm obviously not a doctor, but I do deal with a lot of patients. I haven't been doing it for very long, but I have a couple interactions that come to mind. One was a lady wanting to know if our clinic would do a V card test on her because her PCP told her they don't do that. It took me way too long to explain it's not a real thing. Another lady needed to get tested for STDs, not weird, but she said she needed us to send the results to her prospective employer. Why? We told her we wouldn't do that, but she could come get a copy of her results and do whatever she wanted with it. She does, but comes back later the same day and says we gave her the wrong test results. We double checked. Nope, these are definitely her test results. Trying to sort this out with her, I asked her why her employers would want an STD test anyway. She said it's to make sure she doesn't have tubulars. Then it dawned on me. She meant tuberculosis. She needed a TB test, not an STD test. She gets all angry and yells that we're just trying to trick her into taking more tests so we can charge her more. Then she stormed out. Story 10. Patient in neuro ICU after a subarachnoid hemorrhage dealing substances out of his room. A dumb idea, but the execution was actually kind of impressive, to be honest. Another patient was in the hospital to have her ninth baby, yes, ninth baby, and then give it up for adoption. She was 9 for 9 on adopting out babies. She was 34, had a BMI of 65, no teeth, a creepy partner, I think it was a feeding type of relationship, and no pain tolerance. I was asked to do an epidural. As I'm going through the consent, she's distracted by some zombie pseudo-documentary that she refused to turn off. She had brought the entire DVD set to watch during labor. At the end of the consent process, I asked if she had any questions. She just wanted to know, when can I smoke a cigarette? I told her after the baby was out, she could do whatever she wanted. The adoptive parents, who already had a few of her offspring, were there the entire time. I had to forcefully ask them to leave for the sterile epidural placement, which was remarkably easy given her size, but a little more challenging given the distracting zombie show that she refused to let us turn off. Baby slid out about 30 minutes later, and she was discharged before the end of the day. I think the OBs at least managed to get an IUD into her. Story 11. Medical student, but I have seen a fair number of dumb people already in my first 6 months. Young, 20s, diabetic girl wasn't compliant with her treatment, and all of the dialysis clinics in the city won't accept her anymore. Now she can't or won't go to the suburbs for her dialysis and will likely pass away within a few weeks unless that changes. My advice, if your kidneys don't work, you should probably show up for your dialysis appointments. Morbidly obese man was in the hospital after he fell, needed his edema, heart, and lung problems to be treated, insisted that he only needed help with his legs, started raising his voice and refusing to answer questions because he said they weren't relevant. Then at the end of the interview, he started complaining about his shortness of breath. No crap. And then there's the psych patients, but that seems like it doesn't count. Story 12. As a fourth-year medical student, I spent a few weeks at the ONG, OB-GYN department. I got to sit in at a fertility clinic and saw a couple, aged early 20s, that had been referred to a consultant by their GP as they had not conceived following 14 months of unprotected intimacy. GP had initially suspected polycystic ovarian syndrome as the lady was morbidly obese and had some additional body hair. Her ultrasound and hormone levels, however, showed no evidence of this. So the consultant proceeded to ask them how often they had whether they were monitoring for signs of ovulation, etc. He then asked when they last had and the husband proudly stated, "About 2 hours ago." They both commented on their excellent intimate life, and the husband was asked to produce a sample, so left the room, and the consultant called in a nurse as a chaperone so he could examine the wife, and it is at this point that it became clear what the problem was. The woman was so fat that there were several folds of fat. Within these folds, there was a pouch with a significant amount of white stuff. When it was eventually visualized, with help of the nurse pushing down on the layers of fat, it became clear her thing was intact with a very small opening. Therefore, what they thought was intimacy was instead him going into the folds of fat without ever entering. Story 13. I work in the ED and I had a shift in pediatrics. It was a particularly busy day and people were overflowing out of the chairs, so it took a while to get to the non-critical patients. One mom had been sitting with her daughter for 2 hours, not too long considering how busy it was, and insisted that her daughter be seen. Me? So, what brought you in today? Mom? Angrily. I've been waiting for over an hour and no one has come to help my daughter and she is suffering. Me? Okay, let me see if I can help. What seems to be the problem? Mom? She has a headache. Me? Okay, tell me more about the headache. Daughter, well, I don't actually have a headache anymore. Mom, what? We have been waiting here so long. My daughter doesn't even have a headache anymore. I want to talk to your supervisor. Me. Story 14. I'm a postpartum nurse. This isn't so much weird as sad, but I've never forgotten it. I had a patient ask me, do you ever feel like everyone is watching you and judging you? I told her, yes, I suppose everyone feels that way sometimes. Then she said, when you feel that way, don't you just need a little substance? To which I answered, no, while thinking, if I did, would I tell you? Also, she kept fiddling with her plain fluid IV to make it run faster. I'm pretty sure she thought there was something in it. I had to put it on a pump. The people judging her were her parents, who had custody of her children, because she was engaged to a man who mistreated one of them. After I found that out, I kind of judged her too. So, fiddling with a saline IV like it's a slot machine. Come on, Happy Juice, Daddy needs a win. Too soon? Story 15. Physician here, worked in the ER when an older couple came in after the gentleman sustained a fall at home. The couple was retired, lived by themselves, and the wife drove him there. He never lost consciousness, but nonetheless, we checked him out, ran all types of tests from his vitamin levels to syphilis, including head CT, etc. Anyways, everything comes up negative, including a somewhat thorough physical exam. There was a smell coming from him that we just could not figure out what it was. I noticed that we never took his socks off. Upon further inspection, it seems he is wearing 2 socks on the left. I proceed to remove the socks and out fall 2 of his toes from the left foot, and the rest just stuck like glue to the sock. We proceed to ask them questions about how they never noticed his toes getting to the condition where they are literally falling apart. And to this, his wife says, paraphrasing, Doc, we didn't think it was that important. We couldn't stand the smell, so I told him to just keep the socks on and never take them off. He kept trying to ward off the smell by just adding another sock on top of the one that had gotten glued to his toes. Story 16. In my first week as a junior doctor, I was asked to attend a patient who had been admitted with abdominal pain, appendicitis. The tests were routine biochemistry and hematology to check their inflammatory markers. Explained all of this to her, but she still asked if I was taking the bad red liquid away. Once again, I explained the reason why I was doing the tests, but it just wouldn't sink in. Didn't help that she had around 5 family members all around her and she was difficult to attend to, lots of subcutaneous tissue covering her veins. In the end, I managed to successfully get samples from a vein in her foot. Her dad said, thanks, doctor. Now that bad red liquid is gone, it should mean she doesn't need surgery, right? Trying my best to keep a straight face, I replied that I'll be back with the results in half an hour or so and got the heck out of there. Story 17. Med student here was working with an endocrinologist in her outpatient clinic. This patient was being treated for her diabetes. She had long been non-compliant with her diet and medications, and we had tried everything and the patient was just not doing anything about her disease. The doctor, being fed up, basically told her what was going to happen to her if she doesn't start caring for herself. The patient got mad at the doctor and drove to the store and came back with a bag full of candy bars and decided to sit outside in the waiting room and eat her candy to spite the doctor. I just don't know sometimes. Story 18. I'm a pharmacist from Ireland, so not a doctor, but I remember a colleague telling me about one story. She asked a patient where the suppository she had been prescribed benefiting her condition. I think they were anti-inflammatory. She replied, useless. I might as well have stuck 'em up. I honestly think patients aren't really stupid, but more so they haven't had their conditions explained to them correctly or else don't really want to admit or believe they have a chronic illness. Adds more stress to an already stressful life. Story 19. I know I'm a bit late to the game, but thought I'd vent to this thread anyways. Only been working 2 years, but damn do I have a lot of stories for this exact topic. I'm a rural family doc doing locums and was working at a city family practice clinic when I saw this patient. 21-year-old female, not overweight, in no distress, and appears quite well. Me, so what brings you in today? Patient, I'm sure I had a heart attack. Me, okay, tell me more about why you feel that. What does this pain feel like? Patient, like a heart attack. Me, oh, I see. When did you last have a heart attack that this feels like? Patient, I haven't had one before, but I get this pain every time I have my period, and I've sent my mom to the ER twice with the same pain before, so I know it's a heart attack. She was a non-smoker who had no comorbidities, very non-cardiac sounding chest pain, no risk factors, and her mother that was sent into the ED had an EKG, no work, and sent home shortly after. Though patient swears both episodes were heart attacks. As I'm about to leave the room and reach for the door, she also says, I've also had a stroke about 10-12 years ago. And if you're enjoying the video learning a thing or two from these wild stories, don't forget to hit that subscribe and like button for more videos just like this. Story 20. I'm writing as the dumb patient. I think this might be the cringiest thing I can remember myself doing, and I have plenty of cringe stories. I'm an adult now, female for context, but when I was an irrational adolescent, I was terribly afraid of OB-GYNs. I couldn't stand the thought of going to one, and every time I went to the doctor, I was paranoid that somehow they'd want to do a checkup, and I would be forever humiliated. I know, it's weird, but I was like 12, and I think we all remember what being that age was like. At the time, I used to get a lot of sinus infections, and so I went to my primary doctor for a particularly bad one. The doctor and the nurse came in, and there I was, laying on the table, exhausted from just being sick. But regardless, literally the only thing I could think of was, oh no, it's gonna happen today. Doctor asks what's going on, another few questions, and says, I'm going to check you. My eyes shot out of my head, and I looked at him and just started bawling, locking my knees together. The doctor and nurse looked at me incredulously. It took them a few seconds, but then they both burst out laughing. My mom, who was there too, was laughing with them. No, not that, honey. He's just going to check your sinuses and your breathing, the nurse said. I was so mad I wouldn't say anything else to anyone the rest of the appointment except for yes and no, and I was afraid to go back for a long time. Not the worst case ever, but this doctor, who I was lucky to have since before I was born, just retired a few months ago. At my last appointment with him, we were sharing memories, and he said that he's never had another patient react to a checkup like that. Happy to report, I've grown up a lot since then. Story 21. I'm not a doctor, but I am an optician. I had a guy come in raging that his lenses were scratched, and he bought the scratch-resistant ones, so this shouldn't happen. First off, we give you the scratch resistance for free. It isn't called Scratch Impossible for a reason. Second, we also give you a free warranty with purchase that covers scratches and breaks for an entire year, so it is pretty generous and can be used multiple times a year. Turns out his glasses were just dirty, not a single scratch beneath the filth. Story 22. It's not a HIPAA violation to speak in broad, generic terms. I've had a lot of annoying patients. The one that stands out in my mind was one back when I was in residency training. Pretty minor in the grand scheme, but still sticks in my mind for some reason. I was pulling a call in the hospital, which as a resident meant that any time a patient showed up in the ER who was identified as being a patient even remotely associated with one of our residency clinics, the ER docs wouldn't see them, but would instead have the nurse page the on-call resident. Anyway, most nights on-call meant zero sleep as you would get called to the ER all the time, in addition to your other duties, which by themselves would typically keep you from ever getting enough downtime to catch a few sleep. Well, this one night, the stars were aligned. After a brutal first few hours of call, things quieted down, and finally at about 2 a.m., I managed to take my shoes off and lay down and actually fell asleep. It was blissful. At that point, I'd been working full throttle for probably 30-plus hours, so I was in heaven. Then at about 2:10 a.m., the pager goes off and displays the ER number. Ugh. I call the ER nurse who tells me I have a patient in the ER, so I get up, rub the sleep from my eyes, put on my shoes, etc., and I groggily make my way to the ER. I grab the chart and go into the exam room, and conversation goes basically like this. Me, hi, I'm Dr. Tonga Time. What brings you into the emergency room tonight? Patient, I can't fall asleep tonight. After extensive questioning, that was it. Her medical emergency, which required her to rush her to the ER at 2 in the morning and wake my bum up from blissful slumber, was that she couldn't fall asleep that evening. Ugh. Story 23. Not a doctor, but a patient. My partner's back is a mess and causes him a lot of pain. We had booked doctor's appointments several times before, only for them to fall through due to the office staff's incompetence. We got another book for Monday, Saturday lunch. The pain goes up a notch or 10. He can't lie down at all, sitting and standing or agony, etc. I have medicine and give him paracetamol and ibuprofen. They don't even touch it. I don't know if I can give them together. Google got nothing. Ring 111 because he needed something to sort this. He was meant to be running an event on the Sunday that meant a lot of lifting. They don't even let me ask the one question I ran to ask, but do a full questionnaire on him. Fair enough. Long story short, he's made to pick whether it's a tearing pain or a crushing pain. He says neither. Apparently that wasn't an acceptable answer. Please pick one. He says it's closer to crushing. She says, oh, you're having a heart attack. I'm sending an ambulance. Paramedic's face when he stood outside waiting was a picture. Story 24. Not a doctor, but a medical student. I once had a patient come in for a BP check after starting a new medication for blood pressure. I asked her how everything was going, and she told me she was having really bad swelling with her new meds. Swelling is a side effect of a couple BP meds, but not this one, so I was a bit skeptical. Keep in mind, this woman was morbidly obese with a BMI around 60, but I asked her to show me where the swelling was. She quickly pulled up her shirt and picked up her really large penis and shook it at me, yelling about how the massive fold of fat she was holding was all swelling from her new medication. Suffice to say, we had a very difficult and awkward conversation about obesity and lifestyle modifications. Yikes. I bet that encounter permanently recalibrated the med student's definition of swelling. Now, a slightly puffy ankle looks like a minor miracle. Story 25. These stories right here are why I could never be in the medical field. I'd be too tempted to let natural selection take its course. That said, I do have stories about some dumb nurses. Old classmate who's a nurse had 2 babies in rapid succession because she thought she couldn't get pregnant while breastfeeding. I had an MRI as a young child because I was having a lot of migraines. My mother thought it stood for magnetic resonance imaging, so here's child me explaining to my mother that it's actually resonance, the difference between the words, and how an MRI works. She's a nurse now. I was seeing a new OB-GYN and had filled out all the paperwork online. To my surprise, they gave me the exact same paperwork in the office. Then when I got back, the nurse proceeded to ask me all the same questions a third time. By this point, I was annoyed. When she asked me about allergies, I jokingly answered that I was allergic to oxygen. As I have severe pet and pollen allergies, I frequently make this joke. To which she replied, "OMG, really?" with a look of genuine horror on her face. I had explained the joke. Then we got to the fun questions. Intimately active? I held up my left hand to display my wedding ring. On birth control? No. Oh, are you trying to get pregnant? Yes, you blithering idiot. And you'd know if you bothered to check where I answered that twice already. Throughout the entire visit, I sincerely expected Bill Engvall to jump out and tell me I was on his new hidden camera show. Here's your sign. But he never did. My nurse was just a candidate for the Darwin Awards. I had a pediatric nurse practitioner tell my husband and I that we needed to put KY on our daughter to keep her privates from growing together. I caught a real doctor in the same office and asked her what she thought of that, and she looked at me like I'd sprouted a second head for obvious reasons. I blamed those daytime TV ads advertising nursing degrees in 6 months. They're going to end us all. Story 26. Late to the thread, obligatory, not a doctor. I work for a large mail-order pharmacy, and we, for some dumb reason, don't accept pharmacy transfers, so we have to get the medication names and dosages from the member. So, talk to the member, ask them over the phone the name and how to spell it. V, Z, E, G, and P all sound the same over the phone, so I usually ask them to spell it phonetically. I get a lot of, I said G, me, as in game or gamma. No, V, I said V, me, as in Victor. No, Z, etc. And they get pretty mad when I tell them I can't just order a bunch of medium pills of metformin. They mean metformin, but I also need to know dosage, aka how many milligrams. I also had one lady ask if I could load her up in some Oxy. I told her I would order it, but the doctor had to approve it. She was pretty mad, called me a quack, strangely enough, and an imbecile before hanging up. People are dumb sometimes. Story 27. Worked in a hospital doing security. In the psych first contact ward, we had a call about an aggressive patient. Ends up in a takedown and restraints. In the debrief before we learned the police brought him in for substance use, Schmuck had harmed his own mother. As I'm applying the arm restraints, I noticed a tattoo on the back of his hand that says, "Family first." The irony was too much. His other hand had a tattoo that said, "Screw you, pay me," so I shouldn't be too surprised. Story 28. Not a doctor, but my father is one. Here's what he told me. Woman comes in with her husband for a physical before she has her gallbladder removed. I asked her if she takes any medications, including birth control, to which she replies in a thick southern accent, "Nah, I ain't had no kids since they put these things here in my arm." She was referring to her Norplant, a progesterone contraceptive device. She's 23 and has had 4 children already. After reviewing the upcoming procedure with her, her husband looked at me in all seriousness and asked, "After she has her gallbladder out, does that mean she ain't gonna have no more kids?" I looked at him and, unable to answer without laughing, nodded my head. Story 29. I've got one. I was working at an Indian services clinic a few years ago. We prescribe a Guy Flonase nasal spray primarily for allergies, which starts a conversation. Guy, will this nasal spray give me anxiety like the last one I had? Me, this shouldn't cause anxiety. Let me check your chart to see what it was you had before. I start trying to find out which medicine he had been prescribed previously, but he says, I just threw it away in the trash out front. Do you want me to go grab it? Me? No, that's okay. It will be in your chart, and I won't make you go rummage through the trash. Unfortunately, I don't see any evidence of this dude ever having another nasal spray, and at this point, he insists that he's going to grab it from the trash. He grabs exam gloves from the box on the table, smart move, weirdo, and then leaves the room. I can't stop him. He comes back a few minutes later with an albuterol inhaler. I'm perplexed. Can you tell me how you use that? You don't need to actually show me since that came from the trash. Dude tries his darndest to shove the opening, meant for your mouth, into his nostril. So yeah, we talked about the difference between nasal spray and an inhaler. I hope he learned. Story 30. Guy with type 1 diabetes comes to the ED with a temperature of 92 degrees Fahrenheit, partially obtunded, clearly in DKA. History gathered from his uncle who brought him in revealed that this champ has insulin at home, knows his life depends on taking it, and can feel when he is entering DKA. Over the past few days, he's been sitting in his room with friends playing Xbox, drinking literal pitchers of Kool-Aid, and not taking his insulin. He brought a bag with him to the ED which contained his Xbox. When asked, the patient stated he could tell he was entering DKA and figured he would get admitted, so he should get the Xbox ready to bring with. That's right. He knew his physiology was entering a state of derangement, and his first thought was, better pack up my Xbox instead of taking my insulin. Story 31. You're currently taking these 2 pills for your heart disease, but they're not working as well anymore, so now you need to take one of these new pills instead. Shouldn't I take 2 of them? No, it's a different medicine, so the dosage is different. But surely 2 pills are better than 1. Why are you only giving me 1 pill now? Are you trying to make me worse? No, it's a new medicine that works in a different way, so you only need 1. It will work perfectly well. But 2 pills is better than 1. I'm just going to take 2 of them. No, don't do that. That will be over and you might get very ill. Oh, okay, fine. Actually, these new pills are really small compared to the old ones. Looks like I should take about 8 of them to be equivalent to the old ones. Shall I take 8? No, that will end you, and on and on and on and on. Story 32. I'm a healthcare worker on a throwaway account, so friends and family don't read this. Apologies in advance for the wall of text. In my case, my grandmother and aunt are the dumb ones, and my grandfather is a patient. My grandfather was always incredibly active his whole life. He constantly gardened, fished, and was a woodworker. My grandmother and aunt decided that it would be a good idea for them to all move in together. They moved to a new house that didn't have enough of a yard for gardening, no room for his tools, and no place to park his fishing boat. And to make matters worse, he broke his hip and just gave up. The last several years of his life, my grandmother and aunt had him sitting in a recliner in his bedroom watching Fox News or Telemundo. He didn't speak any Spanish. Eventually, he developed dementia. It was extremely difficult watching someone so full of life go downhill so fast. Anyway, he went into the hospital for a heart operation. Somehow, my aunt and my grandmother lost his prescriptions for pain meds and antibiotics. They happened to have some antibiotics left over from one of their numerous doctor visits. When they gave it to him, they ignored the fact that he had severe reaction to penicillin a few years prior and gave him a penicillin derivative. They claimed they don't really know what medication they gave him. That night, he developed an extremely high fever. When they called me over 24 hours later to convince him to take his medicine, they failed to inform me that they had lost his prescriptions or had given him non-prescribed medication earlier. He was incoherent, had an extremely high heart rate, temperature, and pressure. I called 911. The last thing he said to me was, "Please help me." He passed away nearly a year ago on my birthday. Recently, I got a call from my aunt asking me to have dinner with them on my birthday because it's going to be a hard day for Grandma. A couple of months before he passed, my grandmother stated that she wished she hadn't married my grandpa. I'm not going to spend the day watching them pretend to mourn. I completed my education a few months after he passed away, and coincidentally was hired at the hospital where he passed away. I've got a 12-hour shift on my birthday, and I'm going to spend that shift remembering the happy times I had with him. Then there's a Bud Light at home with our names on it. Story 33. Nurse here, worked at a nursing home and had a mid-60s man in for rehab following knee replacement. Walked in one evening and he was in his bed and had passed away from an unrelated heart attack. Family was called. They came in, obviously heartbroken as this was unexpected. They knew he had heart issues, but nothing this bad. The man's wife was in early stages of dementia and was upset and saying things in the room like, "Why did you leave me, you schmuck?" The 40-ish daughter pulled me aside, very concerned, and asked me, "My mom is saying some very nasty things. Do you think he is still able to hear her?" Trying to be a pro, I thought for a second and answered, in the sense that Jesus can hear you, maybe. In the sense that you can hear me, no. She immediately hugs me and says, oh, what a relief. Story 34. I had an elderly patient once who had fallen and broken her hip, also had some mental health issues, self-neglect, dementia, etc. Following her hip repair, she wasn't really into her physio at all and never wanted to get out of bed. She would only use a bedpan, always refused our encouragement to try to get up to the bedside commode. This made us consult social work to get nursing home papers started, as she would have been going home alone with no assistance. She could not understand why we couldn't just get someone to take a saw and cut a hole in her couch under where her butt would be, then have EMS just take her home and position her on the couch. She said she would be able to arrange for someone to empty her bucket once every 1 to 2 weeks, and she would order takeout for her meals. She couldn't see any issues with that plan. Story 35. ER nurse here had a woman come to triage with her toddler asking to be checked for pregnancy. She said she had 3 positive home pregnancy tests, but she wanted to be sure with a hospital test. I told her we would also do a urine test, and if it was positive at home, it would be positive here. She said, oh no, I know how wrong they can be, points to kid. The test said I wasn't pregnant last time and I ended up with her. I tried to explain the difference between a false negative and a false positive with no success. She checked in. Of course, the test was positive. She wasn't even disappointed over the visit being a waste of time because she still didn't get it. Story 36. Labor and delivery nurse here, and there are just too many stories. The patient who literally thought she was pooping out her baby while pushing. The patient that came in complete and pushing who didn't know she was pregnant and she couldn't be pregnant because he didn't do it inside her. She thought that she was having heartburn and intestinal issues. No, that's a baby. What makes it an even weirder story is that this was her 3rd baby. She ought to know better. Just last night, a first-time dad called saying that he was bringing his wife in and that we needed to meet him at his car with a stretcher. After further discussion, it was clear that she was not in labor and she had just broken her water. He showed up to triage with the baby's car seat and no shoes because she had forgotten hers, so he was letting her wear his. We sent her home to wait for labor for 24 hours. So many women who think their water broke, but once they are in triage, it is clear that they probably just whizzed. I could go seriously on and on and on. My job never ceases to surprise me. Story 37. Had a diabetic with bilateral below-the-knee poor glucose management, glucose consistently in the 400s, and poor hypertension management. BP was in the low 200s systolic. Tell me that he stopped taking his insulin and BP meds because his primary provider had stopped prescribing his substance, and that it would be our fault if he passed away. His provider had stopped it because of the contract due to the patient shopping around with other providers and had positive for almost everything on the screen. I charted everything the patient said verbatim. Patient then left against medical advice because we wouldn't give him any substance pain meds. Story 38. The dangerous dumb would be the sheer number of people who try to break a fever by piling on blankets. Oh, your kid has a 104-degree F temp because you piled on more blankets to break it. Stupid dumb. Honestly, there are so many, but one of my favorites was the adult lady 30 plus who rode an ambulance because a bee sting hurt, and she was afraid of an allergic reaction, even though she had been stung before without a reaction or any signs or symptoms of a reaction this time. Piece of crap dumb. This guy comes back saying he can't pay for his prescription. He was seen earlier in the day, so I start trying to help him. He is mad, telling me that as a hospital we have the medicine and need to give it to him. I do my best to explain that isn't how it works, unfortunately, but I got him a discount card and found the cheapest place in town with it, $24 US. Turns out he still can't come up with the money, so his response was, well, I'll just flood this hospital and see how they start giving out meds then. Being confused, I talked with the NP who saw him. He had been diagnosed with an STD that he got while cheating on his pregnant wife and was now going to knowingly give it to as many people as he could so we would start giving him free medicine. And if any of these stories got to you, here's more for you. Lessons learned, lots of them. YouTube thinks you're going to love this. I'll catch you in that video.